Hi, my name is Olivia LaBelle, and today I will be demonstrating the different topical anesthesia application sites and what tooth it blocks out and area it needs to be applied to and the type of needles. So first off, for any topical anesthesia you are putting in the mouth, you need to dry the area with a 2x2 gauze. Make sure all the saliva is gone and it's dried up. You also need a Q-tip, and you will be placing this directly into the topical anesthesia and without double dipping, only one little dip and you're good to go, not too much on. You will be applying it to the area that you need, and it should stay on for about 3 to 5 minutes, and then it should be wiped away. So the first one I will be going over is local infiltration of maxillary number 9, which is your central incisor. So you're going to dry the area, you're going to dip this in, and we'll be placing it at the apical of tooth number 9. You want to hold it there for 3 to 5 minutes. This will block out the anterior superior alveolar nerve. And the dentist will be using a short needle since it is the maxillary. And the size of the gauge usually is dependent on what the dentist prefers. Next, I will be going over the NP, or the nasopalatine block. So that is just located right behind your central incisors. And for this one, this is commonly used to extract teeth. If you're going to extract any of the interior teeth, you will place it in your topical, and you'll put it right behind like your central incisors for about 3 to 5 minutes. You want to make sure you don't hold it on too long because it can cause burns and it will hurt really bad. It is on the palate lateral to the incisive papilla. And the dentist will aspirate to make sure that they aren't going into the area that they're not supposed to be going into. Next, I will go over the greater palatine block. That is back here, the harder palate in the posterior part of your mouth. It's used to extract posterior teeth on the palate distal to the second molars. And anesthetizes the posterior palate, distal, and canine to last molar. So it's like the whole back area if you need to extract teeth. This goes on if you look at your midline and then you go to your second molar. You will meet directly in the middle, more towards your molar. And that will numb the area. And the dentist will use another short needle for that one. Next is the inferior nerve block. That is typically used to extract teeth or do a restoration. Where it's on the buccal mucosa 2/3 up the pterygomandibular raphe on the lateral. So if you look in the back of their mouth, it's 2/3 down. In the middle. And anesthetizes your one quadrant of your mandibular. And a long needle would be used for this, and it would be a smaller size, so it's thicker. The next one I'll go over is the buccal nerve block. So this is for restorations of the posteriors, which is on your mandibular. And it's on the buccal fold, distal and buccal to the last molar of the occlusal plane level. So if you look back at your posterior molars, it's that space in the back. that's like on the occlusal plane level. You're going to hold it there for 3 to 5 minutes. And this will also be a long needle, about like 25 to 27 gauge. And it anesthetizes the cheeks and the soft tissue next to the mandibular molars. You can do it on either side. For all of these, you can do them on the either side except for like the palates. That'll just be wherever you numb the palate will numb both sides of your palate. Next, I will be doing the incisive nerve block, which is for restorations or extractions. This is on the mucobuccal fold of the interior between the mandibular first and mandibular second premolars. So it's about right in here. Can't really tell. And it'll be about 3 to 5 minutes. It anesthetizes the buccal soft tissue interior to the foramen. And this will also be a long needle, about 25 to 27 gauge. The last one I will be doing is the Gao gates. And this one's just interior to the neck of the condyle. So it's very similar to the inferior alveolar. So it's like in the back, like the same, but it's much higher. Like near the condyle for about 3 to 5 minutes. This anesthetizes the whole quadrant, and it does the buccal mucosa around the molars. So the difference between the Gao gates and the inferior block is that the inferior does not do the mucosa around the molars. So if you wanted to do something with the inferior, you would also have to do the buccal block. For the Gao gates, this one does the whole quadrant and the mucosa of the molars. And that is my presentation on topical anesthesia. Thank you.